Hello, everyone, and welcome back to Health Angel Solutions. Today, we'll talk about thyroid cancer symptoms, early warning signs that you may have the disease, what to do about them, how it will present, and more. Let's get started by going over some basic information about thyroid cancer. In the worst-case scenario, you do have thyroid cancer, but you probably don't because we'll explain why it's confusing. Even if you do, the most common type of thyroid cancer is also the least aggressive form, and that's called papillary thyroid carcinoma. And it has a 5-year survival rate of approximately 97.8%, which is really good news for all cancers. However, even though thyroid cancer is more common than other cancers, it is the most common cancer related to hormones and endocrine systems. And it also has one of the best prognoses of all these cancers. That's good to know right away, and you can read a little bit more about it. Now let's talk about the symptoms associated with thyroid cancer, starting with the neck. This will all make sense once I get started, but in general, you should be aware of some basic information about cancer, including how it manifests itself. Cancer can originate from a variety of tissues and organs within your body. And the earlier it is detected, the better your prognosis will be. Therefore, if your cancer is detected early, that's a very positive sign. Additionally, you should consider your neck, as this image will help you visualize it. There isn't a lot of space between your skin and your thyroid gland. As you can see from this image, your thyroid gland is located in front of and kind of next to your trachea or windpipe. If you touch your neck right now, I can almost assure you that you can feel the hardness and ridges on it. This means that you can also feel your thyroid, which means that if there are any abnormalities within your thyroid gland, like a nodule or cancer, you may be able to palpate it to detect those abnormalities. Because of this, many pancreatic cancers don't show symptoms until much later in life, when they are more advanced and more difficult to treat. However, because of the location of your thyroid, it is typically fairly easy to look at through ultrasound imaging. It is also very easy to feel and to palpate, so we can find abnormalities pretty quickly. Let's talk about some of those symptoms that might arise. First, let's say your thyroid is in your stomach. You might be surprised to learn that the majority of people with thyroid cancer don't have any symptoms at all. Instead, the cancer is typically discovered accidentally during a routine exam. For example, when you visit your doctor, he or she may feel a lump or bump in your neck and say, "We should take a look at this." You then get a thyroid ultrasound, which usually shows that you have a nodule. Based on the size and whether the nodule is growing, you may then get a biopsy. This is the typical method used to diagnose cancer. Thus, even though you don't actually have symptoms, some other thyroid conditions can present with symptoms similar to those of the thyroid. You may feel a nodule and know that you have symptoms like fatigue or other similar symptoms, and you may assume that you have thyroid cancer because of this. However, since most people with thyroid cancer don't have problems with thyroid hormone, you would think that if there was a problem within the gland, it would cause problems with the hormone that the gland produces. We'll talk about this in a moment. Does not always work that way, and other procedures. Although it's difficult to tell from the outside, let's assume that you are aware that this appears to be a nodule and that this is thyroid cancer. We also know that depending on how big the cancer was. So let's assume that it was relatively small. Many thyroid cancers are not very large because we catch them early. If, however, you had thyroid cancer here and it was large enough, it might begin to press as it grows onto structures surrounding your thyroid, potentially pressing on your esophagus if it was behind. Let's talk about some of the symptoms you might experience if you do have thyroid cancer, and only if it's a sufficiently large cancer, meaning it's a pretty big cancer. You could potentially crush your windpipe to the point where it causes changes to your voice. I'll go through a list of symptoms in a moment, but I wanted to show you what it looks like and why most people don't have symptoms. The reason is simple. It has to do with the anatomy and how it functions. Because, as I mentioned earlier, the majority of the time you don't have any symptoms, the first possibility is compression of the esophagus or the trachea. As I mentioned earlier, these structures sit right there, and if it's large enough, it could put you in danger of pressing against them. Other symptoms include difficulty swallowing, swelling or enlargement of the neck, or a bulge in the neck, which is exactly what I was referring to earlier. If you made it this far into the video, thank you. These videos take a lot of effort and time to make, so if you enjoyed them, please hit the like button, subscribe to the channel. This goes a long way in helping us grow. That said, back to the video. However, it is located in the neck and is not directly related to the thyroid. You may experience the symptoms of a thyroid goiter greater, which is simply an extremely enlarged thyroid gland. You may also experience some neck pain, though this is uncommon, particularly when it is related to the rarest form of thyroid cancer. Finally, you may experience a persistent, non-productive cough, which is simply an irritating dry cough that isn't producing any mucus or flaming. All right, those are the signs and symptoms. That's about it. So what's possibly more important is that if you don't have any of those symptoms, you probably don't have thyroid cancer, but you should still get checked out. However, there are other conditions that could lead you to believe that you do have thyroid cancer, when in fact you don't. For example, thyroid nodules are extremely common. Up to 7% of the world's population has one. That's a pretty high percentage, but a lot of people have died from them because, as I mentioned, they look alike, so you have to get an ultrasound and a biopsy. So keep in mind, don't panic if you feel like you have a bump or anything. It's probably a nodule number 2. Gout is simply an enlargement of the thyroid gland. Some things can cause a goiter, like iodine. We'll talk about that in another video. But in general, goiter is just an enlargement. It can occur in a specific area or throughout the gland. Technically, goiter is caused by thyroid cancer because it causes an enlargement. But generally speaking, people don't want to think of it that way because that's not how it usually works. However, for you number 3, I'm just being technical. Finally, thyroiditis can resemble a nodule, though it can be difficult to distinguish between the two. A nodule is typically solid or partially solid, whereas a cyst is filled with fluid. Hashimoto's thyroiditis is simply an inflammatory process of the thyroid gland. When your thyroid gland is inflamed, it will enlarge. It can be painful, though it usually isn't, so you may feel that or feel a little puffy in your neck. And once more, ultrasound testing may distinguish between all of these conditions, as can speaking with your doctor and obtaining certain tests, so let's talk about it. First and foremost, a thorough medical history and physical examination are necessary if you think you may have thyroid cancer. See your physician and ask that they obtain a complete medical history. Do you have any known risk factors for thyroid cancer? Have you ever been exposed to radiation or something similar? Second, ask the person to feel your neck for any lumps or anything similar. To ensure that your thyroid is functioning properly, get a thyroid function or all the thyroid function lab tests. And that covers thyroid antibodies, so you may run tests for conditions like Hashimoto's or other thyroid-related issues. Get a thyroid ultrasound. This will help you understand what's going on inside the gland itself. It will show you whether you have nodules and what they look like. And you can use that information to calculate your chance of developing cancer. Number 4, consider iodine testing. This is especially helpful if you think you may have a goiter. Number 5, consider additional blood tests, such as inflammatory markers. Again, don't panic if you think you have some of these symptoms. This is the full set of symptoms you might expect if you do have thyroid cancer. As I mentioned earlier, inflammation of the gland can cause the gland to become painful, which may be confusing. Therefore, if you get these inflammatory markers and they're elevated, that could be a sign that something else is going on with your thyroid. These are just some quick tips that I think you know. If you go to your doctor, they should do these things for you. As we conclude this video on thyroid cancer symptoms and early warning signs, it's crucial to remember the importance of early detection and awareness. The thyroid gland, though small, plays a significant role in our overall health. recognizing the early warning signs of thyroid cancer, such as unusual lumps in the neck, changes in voice, difficulty swallowing, and persistent cough, can make a life-saving difference. Regular checkups and being proactive about your health are essential steps in catching potential issues early. If you or someone you know is experiencing any of these symptoms, don't hesitate to consult a healthcare professional. Early diagnosis can significantly improve treatment outcomes, and staying informed about your health is one of the best ways to protect yourself and your loved ones. We really hope that this video was educational and useful to you. At Health Angel Solutions, we are dedicated to providing you with valuable health information to empower you on your journey to wellness. If you found this content useful, please take a moment to like this video, share it with others who may benefit, and subscribe to our channel. By subscribing, you'll stay updated with our latest videos, bringing you more tips, insights, and information on various health topics. Thank you for watching, and remember, your health is your greatest asset. Stay informed, stay healthy, and we'll see you in the next video.